Okay. Well, welcome everyone to another session of the Global Studies Colloquium. Today it's my pleasure and honor to introduce Professor Mark Swilling. Well, we sort of share two things, or one thing in common at least, or two things. We're both from Cape Town and both have an interest in urban issues. And that's why it's very my pleasure, because Professor Swilling's career spans and his contribution both inside and outside of academia in engaged scholarship and particularly his pioneering work on just transition in South Africa and beyond. Professor Swilling is a distinguished professor of sustainable development in the School of Public Leadership at the University of Stellenbosch and co-director of the Center for Complex Systems in the Transition. His latest book is called The Age of Sustainability, Just Transitions in a Complex World. Yeah, so there is a lot I can say about Professor Swilling, but I think we want to perhaps hear on his new work on Africa and the COVID and the way forward. I have to say, it is no surprise to me when the government appointed Professor Swilling to the board of the Development Bank of Southern Africa, which is just unsurprising because of his long contribution to South African society, and both in the just transition and urban studies, this pioneering work. So with that in mind, I'll hand over to Professor Swilling so that we can kick off with this colloquium. So welcome, and over to you, Professor.
Thanks very much, Ricado, and thank you, Jan, for the invitation and seeing you again, and Sangwon, and yeah, it's a great pleasure to be with you all in this way. I'm here with my colleague Nina. When Nina and I wrote the chapter on COVID in Africa together, and when Jan asked me to do this talk at 10 o'clock at night, I was too embarrassed to ask Nina to do it with me. So I said, you know, if you want to join us, fine. If you don't, I'll understand. She has a full household and lots of commitments, and I really didn't want to impose more expectations on her. But so wonderful that she's here. And thank you, Nina, for being here. Yeah, I think the chapter that Jan asked us to write is not exactly what we knew, and so I'm here talking about COVID in the African context with some hesitation, I must admit. It's such a rapidly moving and highly complex set of dynamics that no one can really claim to really understand. And yet we pulled the chapter together and for the book, and pulled some themes together, and I'm really just going to run through those thoughts and then reflect on the current state of play, which is really a new politics of vaccine access, which in the South African context has a very powerful historical memory, which is the struggle against HIV denialism and for access to ARVs, with 4 million South Africans now on ARVs as a result of a social movement battle. And there's a replay, there's an echo of that starting to emerge, I can feel. But I'll end up there, which goes beyond the chapter that we did, obviously, because the thing's moving so fast. So let me share the screen. I hope you can see that. So my point of departure is a kind of tale of two Africas. The one theme is really this really extraordinary dynamic, which is these incredible disaster projections when the when the pandemic began versus the actual reality. And as you will see, there's no real easy or single explanation for this incredible divergence. But in a sense, a more significant story is the way in which the pandemic, even though it wasn't as disastrous as it was predicted to be, has exposed the socioeconomic inequalities and vulnerabilities, and in particular the challenge of economic recovery, and what this requires from a governance point of view. So, in a sense, we have to thread these two tales together if we really if we want to understand the significance of what has happened over the last year. So I just want to put up two extraordinary images, which from Johns Hopkins database. This is the first one, which is the world today in terms of over 100 million cases, over 2 million deaths, and the circles is the numbers. So you have a massive circle over the US, and big circles over Europe and over India. And you can see there's only one really significant circle on the whole of the African continent, over 1 billion people, which is in South Africa. And so this on its own is the tale, in the sense that the assumptions at the beginning of the pandemic were that because Africa is so poor, because over 60% live in slums, because there aren't the health facilities, because all the usual narratives about Africa, which is essentially a narrative of not having, of lack, which in terms of recent scholarship is really about the colonial framing of Africa as a continent of lacks. That informs the narrative of, well, therefore, it's going to have maximum impact. You see a replication of the same type of narrative in the climate discourse. If you then look at the African continent itself, it's 3.5 million cases, 91,000 deaths. And as you can see, the heavy concentration in South Africa, away and on all the different levels, total numbers, death rates, numbers of deaths. South Africa's at the top of the list, but starting to grow in North Africa. And there is the unknown outcome of the second wave, which began in South Africa, spreading across Africa. And the second wave, the fatality rate now in Africa is higher than the global average, but that's got more to do with the fact that the global average is coming down. So if you're just staying with the Johns Hopkins database for a minute, if you look at the top 9 or so countries in Africa in terms of total deaths, you can see 44,000 at least. There's new research which shows it could even be double that. But at least 44,000 deaths in South Africa, and you can see the next highest is Egypt at 9, dropping down quite quickly to Kenya at nearly 2,000. And then if you shift to total cases, the list is roughly similar. Obviously South Africa right at the top, and then Morocco very far down, and then Tunisia, etc. But if you go to the death rate, then everything changes. Death rate is the number of deaths per 100,000. So obviously small places like Eswatini and the Cape Verde and so on, Namibia, the death rate is going to be, the list changes fundamentally. And so, that raises a whole range of questions around impacts made in small countries. So I think those numbers kind of say a lot, but here's the kind of shocker that we've just gone through. South Africa peaking in the middle of last year, in winter, and then peaking again at the end of the year. For reasons, there's lots of different reasons people speculate about, but combination of relaxation of controls, the end of year mobilities as people go back to rural areas and the middle class goes on holiday, etc., etc. But it's coming down. So we've just gone through a fairly tough mini kind of lockdown, which has just been relaxed in response to the fact that we are dropping down below 5,000 cases per day, as you can see, nearly peaking at 20. But it's estimated now that not by Johns Hopkins, by others, that about 40 African countries are now into a second wave, but it doesn't look like anything as remotely steep as this. And as I already mentioned, there are 21 countries where the fatality rates, 21 African countries where the fatality rates are higher than the global rate. But as I said, that's got more to do with the fact that the global rate is dropping. If you scan the literature to ask, how do we explain the African phenomenon, and you get there's no silver bullet, there's no single answer. Most of those accounts will refer to the youth factor. 65% of the population below 25. So that's one aspect. Another is the whole cross-immunity issue, and that's got various threads to it. Some refers to the way in which communities who don't have good access to health facilities but are exposed to a range of coronaviruses, flu and so on and so forth, as well as living in slum conditions, may have created some kind of cross-immunity. Then there's a current big debate around data limitations that actually there's a whole bunch of problems with the way in which data actually is collected, even in South Africa where our data processes are not too bad. So there's, in other words, massive undercounting. What is really important, especially in West Africa, is the lessons from previous outbreaks, especially Ebola. And I'll come to that when I talk about Liberia. Then there's a kind of slightly marginal discussion amongst some specialists who say there's a widespread delivery of TB vaccines across the African continent, especially in South Africa, and that may have something to do with it, although the South African case no longer supports that, because we, as I showed you, we started to, people talked about TB vaccines issue before June last year, but then when we spiked in our real first wave, then that narrative disappeared. But it does exist in other parts of Africa. Then there's some who talk about the fact that Africa is probably a big continent where, relative to other continents, travel is actually rather limited. International travel, intra-African travel is notoriously difficult. Sometimes you have to fly to Europe to get from one country on one side of the continent to another. And then using Jan's terms from his introduction to his book, there were rapid hammer and dance responses from many African countries, like South Africa, who responded with one of the harshest lockdowns in the world when there were only 400 cases. And places like Ethiopia started in January last year, Liberia started in January, Rwanda started with harsh lockdowns very early on. So for some reason, across many different regime types, there was very rapid responses in many African countries. So, so that's why, so the explanation is, I mean, it's as I said, there's no silver bullet, there isn't a single explanation. In different places, there'll be different combinations of these dynamics, but this is really a summary, if you like, what you would get. So the first case was reported on the 14th of February, but I love the Liberia story. Liberia is a country, 5 million people, West Africa, and as you probably know, was really very much at the center of the Ebola outbreak. And when they, back in January, early January 2020, when they read reports about the virus coming out of Wuhan and so on and so forth, they responded very quickly because they still had epidemic infrastructure and staff and institutions and international organizations still operative in Liberia, and they just activated an infrastructure and a set of systems and protocols that they had already implemented and had wound down, and they just kickstarted it all again and started screening at airports, preventing certain categories of people coming in, and so on and so forth. And as you can see, there's been quite a few journalists that said, no, we don't believe these numbers, let's go and find out. And they come back and more or less repeat the same basic story, 84 deaths. Okay, it's a small country, 5 million, but the death rate, as you can see, is very low. So you can't really, for the Liberia story, resort to the small country argument. As I said, a range of different responses of many different regime types, the kind of harsh hammer action of South Africa, Rwanda, Senegal, Sierra Leone, and Zimbabwe. South Africa, particularly militarized response, which caused all sorts of tensions when soldiers killed people and beat them up and so on. And there's these awful pictures of the army leaving its barracks and going down highways in marching format and massive militarized vehicles, etc. And it's like, contrary to all the traditions of South Africa, kind of a bottom-up grassroots civil society mobilization culture, this was a top-down hammer response that really obliterated a lot of potential initiatives. And that's very different to Ethiopia's initial response, which was very much a grassroots bottom-up. Since then, they've gone into a military civil war kind of context in the north. But as you can see, the death rate is very low. It's 80 million people in Ethiopia. And again, there's some doubts about this data, but I have quite a number of students, and you don't have large-scale cases and death and so on. So Mauritius is really interesting. Senegal, sorry, I think Senegal's not in the first category. Sorry, Senegal, Ethiopia, and Mauritius are pretty good examples of a softer, more dense approach. Mauritius is fascinating. It has high historical investment in social protection, particularly health, 9.3% of GDP compared to the region's average. Only Lesotho, Djibouti, Botswana, South Africa are above 6%. And 3.4 beds per 1,000 people. The US has got 2.8. The region is averaging at 1.2. So Mauritius's health and it's free healthcare is and there you can see one of the lowest death rates at 0.8. And in a country where data capacity is one of the better ones. I'm not saying it's great, but it's one of the better ones on the continent. So just in the chapter that we wrote, in addition to the hammer and dance responses that using Young's categories, we also talked about the social protection as a response. And in places like Ethiopia, Rwanda, South Africa, Kenya, Lesotho, Namibia, Malawi, Mozambique, and Mauritius, you find increased, one of the responses, increasing social protection measures. South Africa increased the child support grant, did a marginal top up on various other grants for 6 months, and approximately about 18 million citizens in some ways benefited. In Nigeria, where up until in 2015, the World Bank estimated just nearly 1 million individuals were getting cash transfers, increased this to over 9.3 million. last year, a massive scale up in a country not necessarily notorious for its welfareism. So in a sense, hammer and dance responses and social protection responses is what one finds across the continent. There was some survey data generated. We had debates with Jan about it, who really is a bit skeptical about it also. We cut most of it out, but the Partnership for Evidence-Based Response to COVID generated these interesting results. 74% said their incomes were reduced, 72% experienced barriers to accessing food, 38% wanted the restrictions to remain, but 60% said they should be eased to get the economy back on track, but 72% were more or less satisfied with how their governments had responded. So I want to move on to using that as the springboard into the second tale, and just recap what I'm sure many of us here know, which is the context for the economic recovery debate, which is really where the pandemic should be driving us from an economic policy perspective. The context is, well, sustained but uneven commodity-based growth, more or less, for the last 2 decades, and actually very uneven regionally, and for particular nations, ups and downs, but overall, rapid urbanization, the fastest in the world, but over 60% live in slums, which is the highest average for world regions. Africa uprising, 40 countries have experienced mass uprisings over the past 10, 15 years or so. So, that's very different to the Africa rising narrative, which is the first point. And the second, and Africa uprising is the civil society narrative. The dynamics of urban youth. So these uprisings were basically different to previous uprisings. There's 3 waves of uprisings in Africa: the 50s, 60s that got rid of colonialism, and the 80s, 90s that got rid of the dictatorships, and now this is the third one. But what's distinctive about it is the role of urban youth. Massive infrastructure backlogs, in particular energy. So you have a billion people with an energy infrastructure equivalent to what you have in France, and it's a growing regional economy. Very limited social protection, governance challenges, but not of the type that is automatically assumed. The lack narrative. It's a complex governance challenges, and there's a new generation of leaders who are not all, I'm not saying they're all good or know what they're doing, but it's a new generation with a very different narrative. And they do start doing some crazy things, like in Ethiopia. The challenge, the changing global balance of power, and obviously the China factor is a big deal here. And thank God, the champion of the shitholes of the world is gone. So just in terms of the World Bank work that was done, scenarios that were done on earlier last year to kind of say, well, the projected economic growth rates for Africa were about 3.2%. A mild version of the crisis would generate a negative 2.5, and a catastrophic crisis would take you to negative 5.1 in terms of economic growth rates. Exactly what 2020 looks like, we still don't really know. But this was the same model broken down into regions. And as you can see, the Central African region is projected to be worst hit. And I would have expected the southern region to be more heavily impacted, especially in light of what's happened to the South African economy, where we've basically had the worst contraction ever. Even during serious political crises, wars, etc., we've never contracted this drastically. So, I mean, the bottom line, just from this review, is that 16 of the 20 most vulnerable economies in the world, in terms of readiness or capacity to deal with the impact of the coronavirus, the economic impact of the coronavirus, 16 of the 20 most vulnerable economies are African economies. And so I think this is really, for me, the key point. What matters now, really, and this is what we, on the African continent, what we really should be focusing on, is what does the new economic recovery look like from the concession in a climate and resource constrained world? Yes, the pandemic matters, especially as the focus shifts to the inequalities of access to the vaccine. But the key factor over the long term is going to be governance and models of development. And this does mean recognizing the diversity of African governance. And if you then kind of contextualize that in terms of the World Economic Forum new narrative on reset, what does that, what does that mean? Are African governments just going to loyally attend the World Economic Forum and swallow the reset narrative, or is this an opportunity to really think of an alternative that is appropriate to the African context? And I think it would really be, in a sense, a waste of this crisis if it doesn't start, if it doesn't trigger this kind of rethink. In terms of the academic literature, we refer to this in the article, the varieties of capitalism literature, except for one article, doesn't really address the African continent, African economies. The national business systems literature doesn't really either. And we refer to an article that talks about varieties of institutional systems, and it takes into account various factors which the other paradigms don't really do, but in an unsatisfactory way. And I agree with Jan's skepticism about that article, but I think it is, and I'd love to kind of take it further in terms of our own work on the African continent, a more nuanced and a more complex understanding of the diversities. So eventually, after a lot of discussion and reworking, and we then kind of broke up, identified like 5 categories: state-led, fragmented, fragile state, family-led, the emergent liberal market economies, and the centrally coordinated economies like South Africa. And then what's interesting, we try to find correlations between types of regimes and types of responses, but then it's not there. So you have similar responses to COVID across many different kinds of regimes, similar hammer responses across different types, similar dance responses across different types, except for the Senegals and Mauritiuses of life, where you had substantial social protection infrastructures which were enhanced. So if it would really be the state-led, the emergent LME, and the centrally coordinated economies are probably best placed to adapt and adopt economic policies appropriate to the African context. And in my view, although we don't really address this in the chapter, there are these 7 key issues: building state capacity, we're doing quite a bit of work on rethinking what building state capacity really means. drawing on institutional work, literature, and various other kind of agency-oriented ways of thinking. Leapfrogging, in particular, the energy transition, and avoiding the potential disaster of stranded assets. So this does bring in the heavy investments taking place on the African continent in renewables, but there's a lot of gas and oil on the continent. So, how all of that gets put together. Thirdly, the stimulus approach rather than austerity, and that may, is that going to be health policy centered? Diversification and industrial policy, and in particular where the African narrative of resource nationalism gets taken further, which is really just kind of an ideological narrative for investing in greater levels of beneficiation and creating African value chains. But that, especially if you follow some of the narrative coming out of Rwanda, it's about resisting the new imperialism, which especially Chinese. The urban innovations in response to urbanization. So given the fact that urbanization rates are really the fastest in the world on the African continent, over 60% live in slums. They are rapidly becoming really the centers of economic, of significant future economic growth and development. It's where all sorts of mergers come together in terms of youth cultures, information technology, spatial arrangements, cultural formations, melting pots, which is really the focus of the colleague that Jan and I know well, Edgar Pieterse. And then the whole question of reconnection and reintegration with ecological systems, in particular water, soils, oceans, and the kind of water crisis and the water dynamic across the African continent is really, which is obviously climate related, is going to has already started kicking in quite a number of sub-regions. And then how do you work with the kind of rebellious youth cultures instead of seeing them as a threat and as things that need to be repressed? So those are in a sense, the kinds of issues that would need to be addressed if we can talk about a post-COVID economic recovery. So let me just end off with a comment on learning from the South African case. So as some of you may know, in the late 1990s, there was very intense struggles against HIV/AIDS denialism promoted by our president, Thabo Mbeki, and restricted access to ARVs, and as well as a fueling of stigmatization and conspiracy theories. And so social movement mobilization tackled both of those challenges, coupled to legal action, resulting in significant policy change and battles with pharmaceutical companies around price and access and generics and so on and so forth, which, to cut a long story short, results in what we have today, about 4 million South Africans on ARVs. But South Africa, with that history, takes a proposal to the WTO in July last year, which gets rejected. And the proposal was essentially about loosening the protection of intellectual property rights in anticipation of the kinds of medicines that would be needed to ensure that everybody benefits from mass recovery. And in the light of that that failure, what's emerging obviously now is an activist narrative, which is essentially, there's mild and radical versions. The milder version is the international pharmaceutical companies, which, as I said, the social movements in South Africa fought back in the 90s around ARPs. How does that narrative re-emerge around, just let manufacturers in developing countries make the stuff, open access to the IP, and at least licensing, like India's Serum Institute, and South Africa's just bought 1 million vaccinations from the Serum Institute, through to a more radical narrative, which is really about seeing the vaccines as a commons in the context of the pandemic. I've had a couple of discussions with activists in this kind of environment, and I have a feeling that they're going to start getting their act together pretty soon and getting mobilized around this. So I think let me stop here with this kind of landscape approach, and let's hopefully we have some questions and discussion. Let me get back to you.
Yeah.
How do I stop share? Okay, yeah, there we go.
Yes, thank you, Professor Swilling, for that amazing and interesting talk about the African continent. There's a lot that is one can discuss, but I think I should open it up for discussion, for questions. I think Abdul had already a question, and maybe you can start us off. I don't know if Abdul, if you can just unmute yourself and pose your question.
Hello, everyone. I'm Abdul. My short introduction, I'm a PhD student. Can you hear me?
Yeah. Go
Yes,
ahead.
I'm a PhD student at the Department of International Relations, University of Peshawar. My first question was regarding climate or weather, because some doctors here in Pakistan were saying that if the climate or the temperature is high, so there are chances that the spread of the COVID will be low, because the virus is not able to spread as fast in hotter temperatures as it can in lower temperatures. So is there any relevance of the temperature and the spread of COVID-19 in Africa? Thank you.
Shall we take a round of questions, or do you want to answer that one specifically?
Nina, I'm not sure that I've come across a reference. I mean, as we all know that when there are extreme differences between summer and winter, like we have, it is regarded as a threat when it gets colder, and in other places as well. But how that translates into the African continents, especially in tropical conditions, I don't know. I don't recall a reference to that.
All right.
There was a reference to that very early on, with the first kind of sense of outbreak, and an idea that hotter temperatures would kind of arrest the peaks in the virus. But I think that argument has been laid to rest quite a bit when we look at other countries that have experienced, northern countries that have experienced the summer where numbers have peaked as well. So I'm not entirely sure that argument is scientifically backed through the course of the lifetime of the virus.
if I may, this is Sang-Wan. Thank you, Mark, for great introduction to what is happening in Africa on COVID. It's a great overview. I just shared on a chat box on an article published by two colleagues in my department that looks into the relationship between the UV radiation and COVID. And obviously there are a lot of controversies and different opinions on that. And this might be one of the ways in which we can look into the relationship between the climate and the COVID spread. It seems that there is a relationship. Is a higher UV basically reduces the rate at which the COVID spread. But my question to Mark is about the connection between the post-pandemic world versus the sustainability. And a lot of us who are working in the sustainability arena is trying to kind of relate, what does the pandemic means and how post-pandemic world will change from the sustainability point of view. And, knowing that, Mark, you have been working on, working in the field of sustainability for such a long time. And I would love to hear your view, how do you see, what the post-pandemic world means on sustainability?
Okay, can we just have another question? I will give Bishnu and then you can respond, Mark.
Okay.
Bishnu.
Hi, Mark. Thank you for that amazing talk. I've been following similar sort of discussions on the Indian subcontinent, questions of cross-immunity, as well as reporting, etc., because the pandemic seems to be all, the death rates have been falling there. And everybody's a little confounded as to why, because people are not following, social distance, etc. So there's a whole, I think there'll be lots of time where we'll have time to analyze this. But my question is about the vaccine commons. We all know the long, I'm a media scholar, and we all know the very long history of social movements in South Africa, which dealt with therapeutics. And so my question is, from when you've been talking to activists, do they see a different kind of fight around vaccine commons as opposed to therapeutics? Because therapeutics in some ways addresses certain sort of bodily immunities or bodily processes which can be similar for everybody. But vaccines are much more, can be thought of much more locally, right? Certain vaccines work for certain populations, mutations, and now we're going to have all these variants. So in fact, the AstraZeneca might not be effective for the South African variant. I mean, there could be. So are they, with other vaccine activists, thinking of local production, or are they really making claims on Pfizer and AstraZeneca and all these kinds of, I mean, what's the strategy there? Has one emerged?
All right, maybe we can start with those two and then we go to the next two questions.
Okay, and let me call in Nina. So on the post-COVID sustainability interface, in the South African context, but it's echoed in a number of other places, Rwanda, for example. The president, the South African president in particular, but not always supported by his cabinet ministers, has strongly and repeatedly insisted on an economic recovery, which has to be a green economic recovery. And we're all waiting for his State of the Nation address, which is coming soon, where he's expected to give a very particularly strong push for a transition to renewables. So Sang-Wan, we're a very interesting country because well over 90% of our energy comes from coal. But we have a very, very old fleet of coal-fired power stations that are falling over. And a quarter of those have to be closed within the next 6 years. And even if you could build a coal-fired power station in 6 years, nobody's going to give you the money. So you actually have no choice in the South African Context. There's a structural driver, not even a policy driver, a structural driver to close the coal-fired power stations and start a massive renewable energy procurement program, which actually has begun, but it's not big enough. So in a sense, the president has latched onto this because it's a big focus of the Presidential Economic Advisory Council, where there are people who are leading experts in this energy economics. And Mariana Mazzucato is also a member of that council, by the way, and she also has supported that agenda because she's written about it. You have that thrust with a lot of support from business, but you have the Minister of Mineral and Energy who is very resistant to that and still punts coal and nuclear, clean coal, he calls it. And across the African continent, you have an increasing number of African governments that are latching onto the fact that they can access discounted capital on the international markets, green finance markets, in ways that makes it more attractive to invest in renewables than to invest in fossil fuels. And that's reinforced by the increasing disinvestment, initially in coal and now increasing even in gas, by the biggest financial institutions in the world. So African governments are obviously very sensitive to that. So there's a financial and structural driver that actually on the African continent is very, 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 very interesting. This is the most hopeful thing, in my view, on the continent, that there's this, that the economic recovery is increasingly being tied to sustainability, and not just for green reasons. Yeah.
Got you. Very helpful. Thank you.
Yeah. But coming to the vaccine, I've picked up in this is very early days, okay, because I've picked up already in some of the radical. We have a radical journal called New Frame, and some of this debate has started to emerge there, where activists are writing and saying, well, HIV was a very fixed virus, and you had to behave in very fixed, specific ways, and it is applicable to very specific groups, and you could target. But this thing is much more complex. It's all sorts of behavioral dynamics. It's all sorts of cultural processes. Social distancing is a whole different ballgame. So I think in general, the answer to your question would be it's too early days for them to be able to say that they've got a strategy. They've got a set of ideas and an emerging narrative, which obviously connects deeply into the South African psyche because of the treatment action campaign and those pretty drastic politics of the late 90s. Yeah. So I'm hoping that memory is what is going to feed a rapid acceleration of the discussion. Yeah. Unfortunately, the narrative of the commons is very underdeveloped in the South African and African context. So, the rise of, and especially in the European context, of the commons, together with the blockchain and all sorts of other the zero marginal economy and all of the however you want to phrase it, the radical versions of commons-based peer-to-peer production and consumption, that is very underdeveloped in our context. Unfortunately, if it was more developed, I think the idea of vaccines as the commons would actually have a natural place to go.
I think just to, Bishnu, just to add to Mark, what health activists particularly are mobilizing for is a people's movement around vaccine rollout programs. So very similar to the kinds of programs that were initiated around HIV, there's a call for labor, civil society, social movements and communities to be a part and especially to provide oversight in the vaccine rollout program. Our unequal health systems, gender disparities, austerity, and also the aspects of intellectual property around the vaccines as well, trade-related aspects of intellectual property rights, is something that they're really agitating against and calling for a suspension for all vaccine-related information. There's also a call and an awareness building around vaccines and xenophobia. So it touches on the really raw nerve endings in South Africa to mobilize against community responses while addressing all of these other embedded ills at the same time. So I think it's got a much broader and deeper reach and action and call to action than the HIV call had, which touches very deeply into sustainability issues. And it's really amazing that the call is responding to all of these other issues and making them very visible during this time in the pandemic.
Mm-hmm. We'll have Janet and then Alison. Please go ahead.
Okay, hi, can you hear me?
Yeah, very
Good.
well.
Yeah, so several of us here are from a local Santa Barbara nonprofit called World Dance for Humanity. We work in Rwanda and we're in touch with Rwanda every day. So we've been following the developments there every day since this started very closely. And as you mentioned, their lockdown was severe, was strict. It's a tiny country. And so the cases, you know, to us, it didn't seem that many, but for them it was extreme, and they've had a strict lockdown, and they just locked down again really tight. They had a spike recently and closed the country down and decided that the Kigali, that the capital was the epicenter, and that everything is locked down, total curfew, 4 p.m. gonzo. I mean, and so you know, all we know about is Rwanda. I mean, we know it very intimately, but I don't have a sense of Rwanda in the context of Africa, because we don't know, you know, we don't see, we don't feel what's going on. So very practically, in very simple terms, I don't know if this is a crystal ball question, but right now we're in this second spike in Rwanda. They said they were going to open things up. They didn't. They closed them down again yesterday. Do you feel that it's just starting in Africa? Is it relative to the rest of the world? Are they slower getting going with COVID? So I have three questions. One about is the trend of COVID. The other is about education and schools being open or closed in other places, because all we know is Rwanda. And then the food shortages, because we've been just raising money to supply food to people who were out of food. So we raised about $50,000. We're just a little group, but we sent money to individual families because they were out of food entirely. They couldn't farm. Then there was a drought in the summer and a flood in the fall, and so nobody had anything to eat, the 12,000 people that we work with. So those are my three questions about the trends and about education and about food. What's going on in other places?
Alison.
Sorry. So I started to type this in the chat. This is actually, in some ways, a generalization of the kinds of questions that Janet is asking. In general, with other kinds of health conditions and the success of health responses that I've looked at, both historically and cross-regionally, there's really an interaction between the underlying level of social inequality and the regime type and state capacity and those factors that you were profiling. And it's interesting because we had a presentation a few weeks ago by a Brazilian colleague looking at COVID in Brazil, where he very much emphasized the social structural and the social inequality element. And you're very much emphasized, and I was asking him about the regime type and the state capacity. It seems to me that those are complementary and interdependent. And even not just comparing Africa to other regions, but even within Africa, I was surprised, like everyone else, about Africa's relatively lower impact, but I was not surprised that South Africa was the center, because even though it's more developed, it's the most unequal. And social inequality has all kinds of linkages, as I'm sure you're aware, to, you know, public health response and capacity. So the social side, the social inequality, and how that interconnects with the regime responses.
Yeah.
Thank you.
Mm-hmm. Yeah, you can go ahead. Yes.
When Nina and I started, our assumption was that we would find a relatively, not very, but relatively neat correlation between positive responses to the pandemic and regime type. And this had a lot to do with our own experience within our own country. So the Eastern Cape is the most corrupt and degenerate province. And things are just collapsing and disintegrating, and hospitals and blah, 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 blah. And so inevitably, that's where the highest, you know, the highest cases of deaths are. And so at that stage, now that's changed, because the province with the most developed health capacity and hospital infrastructure, which is the Western Cape, has got similar levels. So now, even within the South African context, that those assumptions about cases, deaths on the one hand, and regime types doesn't hold. And then, as we went through various data sets and various forms of analysis and discussion, we couldn't find neat correlations between response types and regime types. So the correlation is much more in terms of, okay, well, how are you going to respond? How, you know, what's the response to recovery? That's where regime time really matters. And so I don't really know how we deal with your challenge. You know, take a place like Liberia. From a governance point of view, it's pretty much a failed state. And then you say, well, why did they have such a fantastic COVID response? Well, it was largely international organizations who coordinated it. So what's your explanation? And then there are other places which, you know, like Mauritius, with a very, you know, well-developed governance structure, high social protection as GDP per capita, incredible number of beds, but and their case and death rates are similar to Liberia. So how do you make sense of this? So that's why I think our orientation, the Brazilian case of just callousness and denialism translating into massive increases in cases and deaths and so on and so forth. Sometimes it's compared to South Africa, where we both have these developed governance infrastructures, developed social protection infrastructures. Both countries have very high incidence, but the difference is we don't have a president who's a denialist. We don't have an official discourse of denialism. We actually have the opposite. We had a severe lockdown, which did have behavioral impacts, but then it didn't last because unlike Rwanda, where you have a regime that has created a rule-following culture, South Africans, you know, if you're in Rwanda and you see somebody crossing the road at a red light, you know it's a South African. South Africans just don't follow rules, and that's this whole question of rule following in Asian countries versus some African countries is I think is an issue. Nina, do you want to respond to this question of pattern? I mean, in general, my simple answer is I don't think we're talking about South Africa being behind and the curves are going to catch up. I don't think it's that.
Yeah, just in the analysis, we didn't find any neat correlations, and we were also wondering what were the other social institutions that were perhaps upholding some kind of social coherence or adherence that could have helped behaviors. Yeah, but there were no clear correlations for us at all.
Mm-hmm. All right, I'll give Jan has a question, and please, if you have questions, just indicate or just raise your hand, and then Jan and then Grace.
Ricado, thanks, and I see, by the way, two others. Say maybe a general point, Mark, Nina. Regime may be too large a category. It is the capabilities, social capabilities, institutional capabilities, state capabilities that actually enable or undermine, and underlying that, a point you just mentioned, Nina, the degree of social cohesion in contrast to social heterogeneity and division is also a major variable. Now, Adalberto, Brazil talked about two types in South America: those who practice collective responsibility, more successful, and those that left it to individual solutions and responses. And then later on, he said, over time, the difference becomes smaller. So time is also an important variable, like Andrea from Rome remarked later on. From broad categories to more precise and subtle ones, like varieties, market economies, institutional systems, may be a better step forward.
Mm-hmm. Grace?
Hi, I had a quick question. It was mentioned earlier that many countries in Africa put in place very strict lockdowns. And I was wondering if that was due to the fact that they potentially have a lot less health infrastructure to deal with the pandemic. So I'm pretty sure Morocco has 1,000 to 2,000 beds for about 40 million people, whereas typically, I guess, in Europe or Western countries, we do have higher amounts of, or higher capacity in hospitals. So is the fact that the cases can get so high almost a privilege in a way that they're able to actually address the health concerns and needs of more people?
All right, Marco and Nina.
Yeah. Sorry, you're calling on me?
Yeah. We'll
okay.
go with those two.
Yeah. No, I think what's interesting in the African context, even in the South African context during the first wave, even in the South African context, there was this anticipation of absolutely of the hospitals, public and private hospitals, being flooded. And even in the middle of the first wave, that wasn't happening. So you have people getting infected, that but it's not translating into the same level of extreme illness that you have to go to hospital. The level is lower, and so so I don't think there's a lot of evidence that that was the fundamental crisis. Access to hospital beds. Yes, in places like Zimbabwe, they had like just a few ventilators and so on. And so, if your question was about if a harsh lockdown without healthcare, well, the government strategists who really promoted harsh lockdown, informed by powerful scientists in the South African country, which influenced the other African country responses, was based on the assumption that we needed to flatten the curve so that you didn't overrun the hospital infrastructure and then face a collapse of the health system. And that was premised on assumptions about not just the rate at which the virus spreads, but the degree to which people are going to get sick. And it was the second assumption that didn't hold. And so it didn't translate into the overrunning of the infrastructure as everybody predicted. And that led to criticism, severe criticism of those governments, saying, well, you wrecked the economy based on assumptions you wanted to protect the hospitals, but look, the beds are empty. And that was extremely embarrassing for our government in particular. And it was a big reason why there was much greater caution in the second wave. Even though it was worse than the first wave, we never, ever had the same level of hard lockdown. And yes, in one or two provinces, the hospitals were overrun, but in general, we got through the second wave, which was worse. So yeah.
I think also we had a very clear sense of the militarized lockdown, and in that, the sense of the might of the state. And it was one of the most painfully decisive moments in our recent history. So we've just come through 10 years of state capture, where there's a high level of distrust. There's no trust in state institutions. They're hollowed out, they're gutted. And in a way, the very harsh lockdown perhaps was an attempt to also say, we're in control, we're competent, we're looking after you while we're killing you. But it was a very shocking moment actually for us in South Africa to see, like Mark was saying, these heavy armored vehicles rolling down the highway, an empty highway, Black people being killed in the townships for breaking lockdown laws. It was a scary moment for us, but I also think it was an attempt by the state to say other things beyond just the COVID moment.
And I think that does link to Jan's point. I strongly agree with Jan's point about focus more on capabilities, both collective and individual, social and institutional. And so you can have a harsh lockdown, which doesn't necessarily build those capabilities. It's a cover for the absence of those capabilities. Whereas in Ethiopia, they also had, at points, quite strong lockdown, but they also had strategies for building those capabilities and actually transferring a lot of responsibility to community workers, just as a way of distracting people from the clinics and the hospitals. So I think different regimes, strong action doesn't necessarily mean capabilities. And so you have softer touches like in Mauritius and Senegal, which had a greater emphasis on collective capabilities and had more success.
All right, Ashish. You have to unmute yourself.
I apologize. Okay, with respect to capabilities, one of the things those of us who've sort of been looking at, social protection systems during the last food crisis, for example, have been thinking about is, well, number one, what do states do when they need to fast roll out social protections and they don't have the basic infrastructure for this? For example, information about who's out there, who is going to be in need of social protection and so on, and therefore, and how to find them, how to target them. So what's sort of the diversity of responses that you have seen? How, for example, does Nigeria get 1,000% increase in social protection spending out there? And have we learned anything about sort of what are the most responsive ways of organizing social protection to reach people when you need to reach them fast?
Mm-hmm. Yeah.
From this example, yeah, from COVID responses, is that?
Yeah. So I mean, the Nigerian story is is really about throwing money at the problem. So from a very limited welfare base, it was, oh my God, this could erupt. Let's just throw a lot of money at people. It's not necessarily about the capability building. If you look at coming back to the South African context, South Africa has about 26,000 frontline community health workers. And the doctors who were advising government did not advise a harsh militaristic lockdown. That is how government interpreted it. The doctors were suggesting much greater use of the community frontline workers. So there was a huge resource there that had been built up over many years that could have been mobilized to actually build the kind of more collective capabilities within communities, and there was some synergy between kind of civil society, people's movement responses in the early days of the lockdown, and these community workers. There was an interface there that could have really been reinforced, and that's what Ethiopia tried. So Ethiopia has a tradition of not being a colonized nation. And rooted in very complex land relationships within the majority, where the majority of the population live within communities and strong kind of religious institutions and so on. They tapped into that and worked with it. So the equivalent of our 26,000 community workers here, which were public servants, in Ethiopia was a whole range of more traditional, more religious institutions, which were mobilized to do very similar work in terms of raising consciousness, channeling people to get to health services where needed, and so on and so forth. So, yeah, I wouldn't see Nigeria as a success story. I mean, and Mauritius is a completely different example of a society that is more rule-based with a big social protection infrastructure, and so that's a very different response of follow the rules. If you're sick, go do the right thing. A kind of more responsive government. They didn't do the harsh militaristic top-down, boots on the ground kind of show of force because they didn't need to. They had nothing to cover up.
Yeah, I have a question on during the HIV response, there was the state sort of denialism. And with the vaccine, it seems to me, I listened to the president of South Africa's address on Monday or Tuesday and sort of reassuring the nation that the vaccine is not being done in dark corners. And I was wondering, is there a sort of skepticism by society in general about the vaccine? I know the Chief Justice was talking about 666 and the vaccine, so I'm just responding. So it's different from the AIDS story, where there's also some level in society about skepticism, and would that affect the distribution of the vaccine if a lot of people are skeptical about the Western, either for population control or other things that people think, and the people throw around Bill Gates and others. So I just wanted to think about the effectiveness of a vaccine program, if there's high level of skepticism, or is it just restricted to a certain number of people?
No, I think it's quite wide. If you listen to the phone-in radio stations, just ordinary people phoning in response to vaccine-related questions by the anchor, a lot of them are saying, listen, I don't care if the president injects himself with this vaccine, I'm not going to do it. I don't believe it. So there's a lot of just gut negativity about it. And this is what the activists are also picking up on. So the activists are picking up on this question of trust. What they're saying is, if the pharmaceutical companies continue to play the game of control of the IP, preventing local manufacturing, keeping everything locked up and secret, that's going to subvert trust in the vaccine. Whereas if you have an open source approach, local manufacturers, jobs being created related to the local manufacturing, local distribution, much more transparency, that's going to produce more trust, which means more people are going to take the vaccine, which means you get to community, to the requisite level of immunity, community immunity by quicker, which in turn has positive economic spin-offs. So the narrative is a kind of profit motive, secrecy, control of the IP approach is actually, in the longer run, economically far more negative. That's the narrative that you see. And they are responding correctly to a deep sentiment in society that the judge, a Chief Justice, actually articulated, because he's rooted in the churches. And that's where the skepticism lies. The charismatic churches, and they are powerful across the continent.
Mm-hmm. Yeah, I don't know if there's any other questions, or if I've missed anyone. I don't know if Abdul and Janet, if that was just comments, or you want to come back. Even Bishnu asked about the social movements, the infrastructure. I don't know if that was just a comment. So yeah, we have about 10 minutes still. If there's any questions that someone wants to come back. Otherwise, I'll hand over to Jan. Janet.
Yeah, I'm sorry, I'm maybe going down to a practical level, but we're so interested because you guys know a lot about Africa, and we really want to know what's going on. So let's take the schools. Rwanda has closed down high schools and colleges in March, and they let them go back to school in November. Now it's touch and go. They've sent back all the kids that are anywhere around Kigali. What's going on in neighbor countries? What's going on in East Africa? Are the schools closed? What's going on with that?
Yeah, I mean schools here, but also in quite a number of other countries, are still in this kind of stop-start mode. Mm-hmm. But again, it goes back to the trust issue. The schools can be open, but it doesn't necessarily mean people are sending their children to those schools, because they don't trust what the you know, how you know, what's going to happen at the school? How does that react back? And I know in the South African context, there's the schools are open, but there are a lot of parents who are still doing homeschooling.
Yeah. And I think it's also about school infrastructure, how confident parents feel about sending their children back, especially to crowded classrooms. There are more than 40 children in a class usually. Can COVID protocols be observed? And so I think that's very uneven across the education spectrum. So yeah, like Mark says, there's a big start-stop, but not a wholesale convinced public.
Okay,
But
so
I mean, but sorry, but next door, I mean, in Tanzania, the president is a denialist.
yeah.
So he says, so Magufuli, we just pray. He says, and there's no lockdown, there's no restrictions.
Yeah.
You know, I've got friends there. You know, I'm going to send you pics from restaurants, and nobody's wearing masks, and schools are open, and you know, and he says, we're fine. You know, so nobody trusts the data even.
Yeah.
So,
except the Tanzanian priests are saying, but you guys ought to take a look at how many funerals we're having. You know, as opposed to the data, they're just saying, take a look at what's going down, you know, but yeah, so education, it's hit and miss, and it's I mean, we support all these high school and college kids, and they're stuck at school. They're all boarding schools. I mean, nobody goes to school and lives at home, so they're kind of just stuck. But the teachers have left, so you know, that's crazy. So with the food shortages, what are comparative? What's going on in East Africa with are people starving? Are people out of food because they don't have their small businesses, they can't buy anything, the businesses are closed. Furthermore, they can't, I mean, in Rwanda, they've restricted the number of farmers that can go and work the land to like 2 people, which doesn't work for these cooperatives and stuff. So what's going on with food?
well, I mean, a lot of the articles and the data shows the shrinkage of the informal sector because of restrictions on trading in public places where they've traditionally been, and you'll find that in in many countries. But the food production continues. I mean, food production, the stuff that I've read on the way in which people are establishing personal informal linkages back into rural areas through family networks, rather than relying previously like they used to do on informal traders on the street corner. But that's all coming back. You can even see that in the South African context. A lot of that is a lot of those informal traders are returning, and they're absolutely central to the food system, especially for the majority.
Are there reports of famine or starvation anywhere else?
Hunger, yes, but not famine and starvation. And I think the supply chains have really been highlighted as a really weak link, and how urban food security and rural food insecurity are very tightly linked, and how people have also been depending on imports so much and been neglecting things that would improve long-term food security, like soil health and those kinds of things. But yes, hunger, yes, but starvation, no.
And that, I mean, that taps into another narrative that I've picked up on these kind of radio call-in programs, where people have said, we don't believe we can take the vaccine on an empty stomach, and we are hungry. So we actually want, we need the grants to continue so that we have food, so that we can take the vaccine. So there's that kind of narrative that I think is going to emerge.
So what is your feeling? Last question, sorry, I'm have so many, but vaccination. So you've all spoken about the you know, the nuanced forces that are going on simultaneously, but what's your gut feeling? Are they going to have vaccinations in East Africa anytime soon, this year?
Well, I mean, the president, when he spoke, and also the Minister of Health, who sits on the committee, the Africa Committee that has negotiated a massive deal for, I can't remember how many millions of vaccinations for African countries. I mean, that's starting. So I think the answer to your question is, you know, the first million have arrived in South Africa. There are quite a few other African countries getting vaccines from other countries, from China, from Russia, and so on and so forth. So these things are going to, it's starting. It's starting. So the question is, how quickly is that going to happen? And at what point does it trigger a social movement that says, this is highly, highly unequal and discriminatory? Because it's inevitable. They say it's going to go to frontline workers, but you know, I'm just waiting for the press report that says, you know, this cabinet minister's wife was sick and she got the vaccine and she doesn't qualify. You know, and imagine what that's going to trigger. And it's going to happen. And then, I mean, the uproar, the richest man in South Africa, and Johan Rupert, sorry, is also a Swiss citizen, and he went to Switzerland to get a jab, and there was an uproar, you know, about the inequality of that. Yeah. So I think that's the dynamic, and how that connects across borders, how that connects different. There's an incredible commonality of interest now. Especially young people connected through social media, etc., in the cities around feeling excluded as people get sicker, especially if there's a second wave that gets worse. You know, so that kind of dynamic, if it's given with the right kind of media and the right kind of connections and the right kind of facilitation of activist workshops from different parts of Africa, that could really fuel this kind of bubbling uprising that's been going on for about a decade.
Is Bill Gates going to be able to?
Thank you. Yeah. Thank you very much, Professor Swilling and Nina, for a wonderful presentation and talk. Yeah, I think Jan had to run off to a class. This was very fascinating, and we will continue with the conversation. I think there is a edited volume where your chapter would also come out. I don't know if it's still this year or next. So yeah, so I will.
It's going to come out, but it's already out of date.
So thank you. I don't know if Brett wants to come in. I see you have something in the chat about an email.
Oh, no, just so yeah, the talk is being recorded, and we will post it on the department YouTube channel within the next couple days.
All right. Thank you.
Thank you so much.
Thank you. Really good to meet all of you.
Yeah. So Brett, I don't know what is the.
Thanks, Nina.
Yeah.
Yeah. Just
thank you, Nina and Mark.
Thanks everybody for joining.
Bye. Thank you.
Thank you.
Bye.